So when you come to see me for conservative management of any kind of bladder related issue, peeing issue, things like that, then I'm going to do conservative treatment. So this is what people do before surgery and also after surgery. So if there's a problem that can you want to try conservative management of, then this is the way I approach it, which is more comprehensive than most physical therapists or other people who deal with the bladder. So my orientation is around the transverse planes of the body, which go front to back, the horizontal planes, and they're in the head, where the head hooks onto the neck, where the neck hooks on to the shoulders, the respiratory diaphragm, and also the pelvic floor. So those transverse planes need to be aligned in order for everything to move properly and to situate itself properly inside of the body. I'm talking about muscles, I'm talking about tubes, like for blood, for urine, for the lymphatic fluid. I'm talking about organ movement. I'm talking about lungs. I'm talking about everything. Those transverse planes have to be set up. And then after we work with setting up those transverse planes, we work with organ movement patterns. So that, for instance, the respiratory diaphragm, you need to have kidneys and liver that are moving properly in order for that respiratory diaphragm to move properly. And so those things need to be in place. The respiratory diaphragm has to be in place in order to remove all of the fluid out of the pelvis. I'm not talking about pee, I'm talking about blood and lymph. That goes up. And so we got to get that coming up before we work with any kind of congestion in the pelvis that might be related to bladder function. We got to get the breathing optimized, because breathing is what pumps the pelvic floor and the respiratory diaphragm and moves all of the intrapelvic and intra-abdominal organs with every breath so that we get proper deep lymphatic drainage. So we got to work with the breath, getting the rib cage to expand and getting the core activated properly. So yes, the muscles have to be activated properly. We need to have that core activated so that we can have that bladder lifted and supported, and so that we're having the right pressure gradient system in the body. And finally, we work with bladder form and function. So when we do the treatment, we focus on using manual hands-on therapy, and that involves opening the drainage channels out of the abdomen and pelvis that all go up into the collar area to recirculate blood and to dump the lymphatic fluid into the vascular system. Everything starts in that collar region, because we can't stir the pot in the belly and the pelvis and get more fluid moving around down there without it having a place to go. And so that's why we start up in the collar region. Then we stabilize these transverse planes above the bladder so that there's a lift in the system, and we don't have to be fighting to push the bladder up. The bladder should automatically be lifted when everything above it is functioning properly. And then we work to mobilize the neighbors of the bladder. So that means the sigmoid colon on the left, the cecum on the right, the ovaries, the uterus, the rectum, the fascia that goes around those things. All of that is really, really important to mobilize and free up the bladder so that it can remember what it's supposed to do and how it's supposed to do. Then we work on the breath, which I was saying before. Every breath in pushes the respiratory diaphragm, the pelvic diaphragm down, and then the thoracic outlet diaphragm, the throat, and the head diaphragms up with the expansion of the breath. And then, of course, goes in the opposite direction when you breathe out. So what's supposed to happen is when we breathe out, there's slight distension of the abdomen, because when the respiratory diaphragm pushes down, that displaces the abdominal organs a little bit. And so then there's a little bit of distension in the belly, and then the pelvic diaphragm pushes down because the respiratory diaphragm pushes down. When we breathe out, the respiratory diaphragm, the pelvic diaphragm go up and the core comes in because air takes up volume, it takes up space. And so when there's less air, then everything should go up and in. That's below the lungs. So a lot of people have this trained wrong in themselves. So you'll see that when they cough, there's a downward movement so that they're like exerting pressure down through the respiratory diaphragm, the pelvic diaphragm, and out through the abdomen. So the abdomen will push out and the pelvic diaphragm will push down. If they cough, if they laugh, if they sneeze, if they lift, if there's any kind of increase in intra-abdominal pressure, this is not correct. What should happen is that when there's less air in the system, less volume, the pelvic diaphragm and the respiratory diaphragm should go up. You should push the air out with the diaphragms, and the belly should come in, pushing the air out. So laugh pushes air out. That means pelvic floor goes up. That means belly comes in. A cough pushes out air. That means pelvic floor comes up. Belly comes in. So most people don't do that who have problems with their bladder. Most people just let it go. And that's pushing down. So you have this kind of like resting downward pressure that then is just enhanced with many of these kind of normal behavioral patterns that we have in daily life. And so all that has to be retrained, and it takes thought and consideration to do those things. So there's definitely with any kind of bladder treatment, there's a lot of home care. There's a lot of thinking and becoming more present in your body and reclaiming your space. That's super important. You're not going to get a passive bladder treatment that's going to, hold. It's not going to be enough in practically any case, I would say. Any case that's significant enough for you to come in and get care. You're going to need to work with the breath, the core exercises, and retraining the function of the transverse planes and the core. And then we work with the bladder through the abdomen. I work through the abdomen first, and then we do the intrapelvic care for the bladder. And so that means working through the vagina or through the anus to help position the bladder, to help turn on the muscles of the pelvic floor properly so that they're all working in concert, not too tight, not too loose, working at the right time. And then, we go back and refine the whole thing. And so that's what treatment looks like. It's really worth it to get conservative treatment if you're willing to do the work. It does require work. And so if you don't want to do exercise or practice being embodied, then it's probably not the right thing for you. But if you do want to do exercise and practice being in your body, then it could be something that would be very, very beneficial for you. Thanks.